Bonsoir tout le monde. Vraiment, je voudrais remercier professeur Jamal Belkhadir pour cette invitation à participer au deuxième colloque international sur le diabète et la nutrition. Aussi, je voudrais remercier Diabète Morocco pour cette invitation et je suis ravie d'être parmi vous tous et toutes. Grand merci. Je vais faire ma présentation en anglais, mais je voulais bien vous accueillir en français. My topic for today is about the Mediterranean diet, the gold standards for diabetes prevention and management, a very interesting topic. And I am very happy to be here. I am Dr. Jackie Kassouf Maalouf, Vice President of International Diabetes Federation, IDF, and the founder and president of the National Diabetes Organization in Lebanon, DIALEB. The points we will be discussing today is a little overview about non-communicable diseases from a specific perspective, another short overview about diabetes. We will then discuss what is the Mediterranean diet specifically. We will go over some research supporting the Med diet and its correlation with diabetes. That will make us jump into certain conclusions. And then we will be talking about the very important call to action, not without mentioning, of course, the references. So when we say non-communicable diseases, there are some very important facts. The non-communicable diseases, or NCDs as we know them, or chronic diseases, they kill 41 million people each year, which accounts for approximately 71% of all the deaths globally. And the NCD-associated mortality is expected to increase, which really puts a red flag. And that's why we're talking about this today. Now, the non-communicable diseases have core modifiable shared risk factors among cardiovascular diseases, diabetes, cancer, and chronic respiratory. And when we say modifiable, we need to know that, yes, we can modify those risk factors, which means we have the decision in our hands. Those modifiable risk factors shared amongst those four diseases are the use of tobacco, the unhealthy diet, to show you the importance of the topic we're discussing today. Physical inactivity is a major risk factor, and harmful use of alcohol. So you can see how important is diet, and yes, it is in our hands to modify it, being shared risk factors amongst all these diseases. Now, if we go and talk specifically about diabetes, I'm sure you've all seen the slides, you all know what we're discussing, but there is a point in showing it again to you. If we talk about type 1 diabetes, which accounts to a maximum of 10% of the total cases of diabetes, we know that it is not preventable, unfortunately. But again, to manage it properly, we need to lead a healthy lifestyle, so diet is very important. When we think of type 2 diabetes, which is the 90% of the total cases of diabetes, we know it can be prevented through lifestyles, through a healthy lifestyle, proper diet, and exercise. And if we have the cases of those big numbers of people affected by type 2 diabetes globally, we know that to manage diabetes properly, to keep the HbA1c low, we also need to lead a healthy lifestyle. So it is extremely important for diabetes patients and for prevention of diabetes to focus on a healthy diet. Of course, we know that gestational diabetes, even though we have the risk factors, can also be prevented by leading a healthy lifestyle for the pregnant woman, by watching the diet during the pregnancy. So this slide shows us clearly how important it is to discuss proper eating habits, a proper diet, and in this specific case, the Mediterranean diet that we are focusing on today. Some numbers related to diabetes that show us how big is the burden of the disease, globally speaking, and of course, according to the International Diabetes Federation, IDF, 537 million adults worldwide have diabetes. When we say adults, that is 20 to 79 years of age or more, maybe. 73 million of those live in the Middle East and North Africa, the MENA region, our own region. What is furthermore calling to attention is that 1 in 3 of those adults are undiagnosed. That is the importance of prevention and leading healthy lifestyle. And we have 541 million adults in the world with increased risk of developing type 2 diabetes mellitus or going through the phase of pre-diabetes. All those huge numbers tell us more and more how important it is to either prevent or take a better control in the management of diabetes. In the management of particularly type 2 diabetes mellitus, which we said before accounts for 90% or maybe a little more of the total cases of diabetes, of course, we have, first of all, to check with your physician, and then we can discuss. Improved diet comes in the first place, equally regular exercise, and to monitor and keep a healthy weight, the medication prescribed by your doctor to control the blood sugar, and the self-management, again through lifestyle, because at home you need to control what you eat, but of course following the guidance of the healthcare professionals. We come to the main point of our discussion today, the Mediterranean diet. Now, it is said that it is the ideal model. Why? We can see through this figure in the pyramid of the Mediterranean diet that if we start from the top, I will start by the things we least have to in consumption for the Mediterranean diet. The less often used should be the meats and the sweets. Again, you need to remember here the concept of moderation in everything we do. Weekly, it tells us to consume in moderate portions the poultry, the eggs, cheese, and yogurts. More often, which means at least twice each week, the fish and any other type of seafood. And here I have to point out that our Mediterranean region is very rich in what we need to consume in large quantities in our diet. We are so lucky because this diet really is applicable on our regions. Now, every day we have in our meals to have vegetables, fruits, whole wheat grains, and the magical olive oil. Again, we are so blessed to have so many olive trees in our regions and to have the extra virgin olive oil, which is said to be a medicine. And also the beans, the nuts, the legumes, seeds, herbs, and spices. You can see the variety, and I don't need to point out that we also need to have variety of colors because the vitamins vary as the color of the fruit or vegetable vary as well. And we need to adapt the Mediterranean diet and practice along with it some kind of physical activity. We don't need to be athletes. If we are, then the more the merrier. But at least we need to walk, practice some kind of exercise, maybe dance, do family activities along with the Mediterranean diet. As magical and as healthy as the Mediterranean diet as it could be, we need to remember that it needs to go hand in hand with physical activity. Now, we saw the pyramid in the other slide. Here, I need to call your attention that the Mediterranean diet should have approximately, and the percentages would help us to choose our plate and to know how to decide on our daily meals. 5% only of meats and sweets, and if we can skip on those sweets or have a very, very little portion, it would be much better, of course. 20% of fish, seafood, poultry, and eggs, and sources of proteins. 10% of the olive oil, which is a great source of good fat and very much needed for many functions in our bodies. 35% of whole grains, pasta, beans, and so on. And 30% of the portion we consume daily should be vegetables and fruits, and remember the variety of colors. Now, I would like to call your attention that not all Mediterranean diets are healthy. We have certain dishes and we have to be realistic and take that into consideration. For example, part of our Mediterranean diet include raw meats. Of course, we need to limit the consumption of those and remember the concept of moderation. And also, we have had an invasion of westernized diet in our societies, so we need to be also mindful of that. To speak about the concept of the Mediterranean diet, we know, of course, that it was launched or discovered or talked about by Dr. Ansel Keys in the 1950s, and it is within the Mediterranean regions, and the benefits of it have been discussed over many studies associating the Mediterranean diet in reducing obesity, cardiovascular diseases, and of course diabetes, and also reducing the abdominal fat, and we know how much that affects positively in prevention of diabetes and other NCDs. The concept of ABCDMV, or principles of diet, which means, I'm sure many of you know about that, so this would be a good reminder that when designing a practical eating regimen or diet planners recommend most of the time those principles, the 6 basic principles. They are adequacy, balance, calorie control, the density of the food, moderation, and of course, variety. And I personally highlighted the 2 words being balance and moderation, because I think they are the base of everything else. When we follow the concept of moderation in our meals, of course, we are limiting the harm that some of the food we consume in our daily diets can do to our health and to our bodies. And of course, you need to be mindful. This is the key for good health when you follow balance and moderation. And of course, the other principles are not less important. I just wanted to highlight that mindful eating is about moderation, and it is the key to a good health. Furthermore, about the Mediterranean diet, we need to know that despite its anti-inflammatory and cardioprotective effect, it is not being followed as it should. So we have low to moderate adherence to this dietary pattern. It's a shame, because we live in an area where we have all the good foods, and we're not most of the time taking the full benefits of those magical foods, or good foods as we call them. So in view of the alarming rise in diabetes cases, especially in our region that we know it is on the red map of diabetes, it is very crucial to provide evidence supporting actions that improve glycemic control and, moreover, the quality of life. I'm sure we all focus in our campaigns and in our diabetes management guidelines on the quality of life of the people living with type 2 diabetes. Some statistics from our region, we mentioned earlier that there are 73 million adults 20 to 79 years of old who are living with type 2 diabetes. And this is a study from 2021 from the Diabetes Atlas of the International Diabetes Federation. And it is said that we might have an increase to 95 million by 2030 and 136 million by 2045. I think these two lines by themselves are a call to action. We should raise a red flag and focus more on changing our lifestyle to the best. We have 27 million adults living with diabetes that are undiagnosed. Again, this is in our MENA region. 48 million adults are living with impaired glucose tolerance, IGT, and this is tending to increase to 81 million by 2045. And we have 1 in 7 live births affected by hyperglycemia in pregnancy. Very high numbers, but there is a modifiable factor that we should really be focusing on. This is to strictly follow our healthy Mediterranean diet that globally is being said that it helps prevent so many diseases. Now, I will go quickly, not in details, over some studies supporting the Mediterranean diet. We can see some being done in Iran, over 71,000 participants. We can see some others from Italy, all of them on adults with type 2 diabetes, even some paper review. The results are mainly all of them showing significant difference in levels of HbA1c, cholesterol, and HDL. Most of them show that it affects obesity in a very positive way. It lowers the risk of microvascular complications for people living with type 2 diabetes. In other studies, we can see that it has affected the BMI, that we most of the time recommend to keep a good number for the BMI as it affects your overall health. In other studies, we can, or in a paper review, we can see how efficient the Mediterranean diet is for prevention and glycemic control for people with type 2 diabetes. It has also been showed in a systematic review of randomized clinical trials that it helps in the reduction of body weight and lowering the levels of HbA1c. So furthermore, some other studies done, for example, in Australia, another paper review, and systematic review of 108 papers, all of them have shown in general health and quality of life improvement, decreased HbA1c level, and also lowering the total cholesterol levels, the LDL, and a lower risk of dyslipidemia. If we gather the benefits showed in those results, we can say that yes, Mediterranean diet is a magical diet, but we need, of course, to stay away from harmful westernized diet that has invaded our society, and some items that we need to be mindful and consume in moderation, although they are delicious and they are part of our Mediterranean diet. Now, in conclusion, we can say that we have strong evidence regarding the inverse relationship between the med diet adherence and the incidence of type 2 diabetes. So the more adherence we get, the better results we get. And when we talk about adherence to med diet, we have found it to be low to moderate, especially in patients with type 2 diabetes mellitus, which is by itself another call to action. They need to stick more to the healthy dietary patterns that the med diet offers. And also, we have to talk about type 2 diabetes related mechanisms such as anti-inflammatory and antioxidant effect, and changes in gut microbiota, which tells us that we need to reinforce those guidelines and to recommend to the patients to stick to the healthy Mediterranean diet. And of course, considering the merits of the Mediterranean diet and the sustainability it may offer, the adoption of the Med diet as a healthy eating behavior should be further encouraged by public nutritional policies as well as healthcare professionals, which tells us that endocrinologists should send the patients to the dietitian and tell them to stick to the models they will offer them and to stick to the Mediterranean diet, as it can help them control and better manage their diabetes. When we talk about the call to action, the implementation of a nutritional intervention, education on specific Med diet components is important because there are some misconceptions around that, and education on the health benefit of the Mediterranean diet and what types of fat to use. We mentioned during the presentation how important it is to consume of olive oil and how blessed we are to have it in abundance in our region. Now, the provision of low-cost, quick and easy meals to prepare, culturally tailored for Med diet recipes. We need to reinforce that. There are many existing, but we need to tell the patients, make them aware of those recipes, and they are healthy and they will not represent a higher cost to them. So through these, we would be helping to have more adherence to the Med diet. And of course, one of the calls to action is to create food tasting sessions to promote the acceptability of Med diet components. Those are, of course, recommendations for the call to action, but I am sure they will reflect very positively on the lives and especially the quality of life of our patient. And this is what we all want. A brief showing you in this slide the references, of course, being IDF one important reference. I would like to thank you for your patience and for listening to this presentation, and end also by thanking Professor Jamal and the Morocco Diabetes Association for the invitation. I hope you have benefited from some of the studies we have mentioned and the facts we have mentioned in this presentation. Thank you very much. Merci and au revoir.